So if your worldview or your research paradigm is of a constructivist who believes that there are multiple realities and it should be explored using qualitative methods, or if my approach is that of a pragmatist, then I'll think that this truth is constantly changing and the best method, whatever it solves the problem, that should be my approach. Then I'll go for a mixed method study. So in either of the two, either a mixed method study or a pure qualitative, you need to draft a qualitative protocol. So let's say we have started with the same question which we have shared, like what are the perceived barriers to effective patient communication among healthcare workers in managing chronic disease in a tertiary hospital setting. So first, we need to select an appropriate design for this. An appropriate design could be like you can explore this problem using any of the methods which we discussed yesterday. You can use a grounded theory, you can go for a phenomenology, you can go for a qualitative descriptive, or you can go for narrative and a case study also. And you can also adopt for a mixed method. When you start with knowing the burden, using some checklist or using some tool, like what is how is the patient communication, or the what are the barriers, and then you can do a explanatory, a sequential type of mixed method study also. So it depends. So the selection of the research design, which we have discussed yesterday, the research approach, that depends on our worldview assumptions. What do we think about that, and which method we think that is the best, and the procedure of inquiry, how I should inquire that particular central phenomena, that depends on that also. And according to that, I will adopt a specific method of data collection, analysis, and interpretation. Because the method of data collection, although we say that largely it is the in-depth interview, focus group discussion, but largely when you go for ethnography, then you have to do the participant observation also. And then you collect the data, like the already established records. You take some photographs also if it is available, and then you analyze, and then way of analysis and interpretation, it will be different depending on the type of study. We will see how, although the basics will be the same, but still, as we have seen earlier, that it depends on the level of interpretation. So if you are just seeing from the above, not going very deep, then you are basically doing a descriptive sort of analysis. If you are putting your own nuances and in your own interpretation, then it becomes interpretive, more of interpretive. But that takes time. Interpretive always takes time and a lot of your energy. That means you have to sink yourself in the data and in the participant voice to get an interpretive analysis out of those transcript. So if the question is like people perceive various barriers in effective communication between healthcare worker and patients in managing chronic diseases. So again, like what is our worldview for this problem? So do I want to know the burden of this problem? Like I said in the beginning, do I want to know the reasons of this problem, or do I want to know both the burden as well as reasons for this problem? So if I just want to know the burden, like like what is the burden of this communication problem, then my worldview or the research paradigm will be that of a positivism. If I want to know the reasons, then I will entirely go for a constructivist paradigm. And if I want to know both, then I'll go for this pragmatist paradigm. So once I have fixed my worldview, then I will decide what strategy or procedure of inquiry should I use to know about my worldview, the solution or the problem for that given research question. So if my worldview is that of a positivist, so I can use a cross-sectional study design classically, which we see, or I may use a longitudinal study design where I keep on following maybe clinician or a particular person to see, or maybe the patients to see the type of communication and the extent of this problem. And if I want to know the reasons, then I'll go for a narrative or a phenomenology. And if it is both, then I may like club narrative as well as the cross-sectional. So then if I have fixed this, then what specific method of data collection and analysis and interpretation I should be using. So if my paradigm is that of a positivism, then I will use the data collection method as survey. Generally, we use survey, and it can be a record-based data also. If I'm going for a pure qualitative, then I will be doing the focus group discussion. I might do the key informant interview and the in-depth interview, or I may adopt both these two procedures. So you can see here that we are going step by step. Initially, we discussed what method of data collection, then we discussed what tool we can use, and then we are discussing the interpretation depending on our worldview. So if we see any of the qualitative research protocol, it should have major, these are the three sections. So the first section, like we have seen this in the quantitative protocol also, that starts with an introduction. Then there is a review of literature, and then there is a methodology. So review of literature in case of a qualitative, we'll discuss what are the features. So let's first start with the introduction part. So the introduction of this qualitative, how to write, it is slightly different from what you write in the quantitative, although the basics are same. But like headings, you should know what are the headings under which you should write the introduction of a qualitative protocol. So first is the background. The second heading is the problem that you write in the quantitative also. And then significance. We'll discuss what is the significance, then what is the purpose of your study. We'll discuss each of these points separately. And then comes the research questions. Then you define your term. In quantitative also you define, but you define those terms in the methodology section. Like what do you mean by current smoker, or what do you mean by cases, what do you mean by controls, that you define in the methodology. But here you define these terms in the introduction part, and then you write your assumptions. Assumptions, we'll see. These sections, if you go through your protocol, which we have shared, all these sections are there. Then you write the limitations of your study, and then you write the delimitations. We'll also discuss what is the difference between the limitations and delimitations, and then we write the overall conclusion of our study. So starting with the background and problem and then significance. So here in this paragraph, someone can read this and we'll see in these paragraphs, there are 3 color coding and how to identify what is the background, what is the problem, and what is the significance. So yes, can someone volunteer to read these?
Can I go ahead? Can I do it?
Yeah, sure, Dr. Abhijit.
Yeah, despite the availability of communication tools, healthcare workers in tertiary hospitals often struggle with effective patient communication, especially in managing chronic diseases. Factors such as language barriers, time constraints, and low health literacy contribute to this issue, affecting patient outcomes and adherence to treatment. Exploring these barriers will help improve communication strategies, leading to better care and outcomes.
Thank you, Dr. Abhijit. So you can see that the first three and a half lines, which are marked in yellow, this is showing the problem basically. Problem is not, it's the background information. It's not the problem, sorry. It's the background, like there are communication tools and still there is a problem. That means the healthcare worker, they often struggle with the effective patient communication. So this is the background of this problem. And then the red color sentence, which is the factors such as the language barrier, time constraint, and low health literacy. So roughly I am identifying few of the components contribute to this issue affecting patient outcome and adherence to treatment. So this is the problem, that because of the time constraint, because of these barrier, there is a issue with the adherence of the treatment for the chronic diseases. And then if I solve these problems, then of course there will be better patient care and outcome. So solving that research question will help in solving what? That comes
Can I ask a question?
Yeah, sure.
I'm a bit confused. That's the reason. So in this case, I mean, if you look at the grounded theory, as you explained yesterday, It's about evolving a theory by undertaking research, data collection, cyclical data collection, analysis, collection, analysis. So this would not come under the grounded study approach because here we already have the problem defined in terms of health literacy and time constraints, which otherwise we would have evolved from a cyclical data collection. So in
Yes.
this case, how do we categorize this as a research? Which type of research would this be then?
So we will discuss it today also. Generally, whenever you do a literature search, so you have got like you make a literature map where you identify these factors. And remember, in grounded theory, what we discussed, it is not always the identification of a new theory. Rather,
Filling of gaps.
yeah, even if some gap is existing, by doing research, you can fill that gap. So that is also one aim. The second is whenever you start making a questionnaire, like for interview guide, you should
Mhm.
have something. And definitely, there is no such study where you don't have anything. But even if, let's say, a factor like I'll give you one example of a study which was done in Mumbai. There they have found out this problem that the women, the slum women, they used to go, they have to go use the washroom in a community toilet. So whenever they used to go in the morning, I think there was episodes of eve teasing. So what they started taking some tablets prescribed by I don't know whom, which was delaying their bowel movement and
Right.
bowel habits. So and then what happened, like after a few days they started having that abdominal distension or so. So then they led to a lot of which led to a lot of complications. So
Okay.
that study got funded by Gates Foundation, and they explored these reasons. They explored later.
Right.
Initially, they
Okay.
complained. They got complaint of only bowel distension of several women living in that slum. So then, when they explored it qualitatively, so maybe this research question that was not explored
Right.
anywhere, because that was very unique to that particular locality. So in a qualitative, it depends on your research question. If it is a very new to a local context, then definitely you will not find any literature
Right.
supporting that. So in that case, you have to go from scratch. Then there will not be any structured or
Right.
even a semi structured interview guide. Your interview will happen the way it gets unfold and the people are answering, the girls are answering. So in
Right.
such case of study, when there is nothing and it is so unique, the problem is so unique that you don't find any framework, then definitely you have to go for the
Right.
grounded theory. But
No, because all the articles that you shared yesterday
yes,
for us as an assignment, I realized that while writing a qualitative research study, it's probably imperative to put across what kind of study this is going to be actually, because it's defined whether it's an ethnographic study, whether it is a phenomenological study, or whether it's a narrative. So, is it a given that when one is developing, suppose if I'm developing qualitative research proposals for somebody. So therein, I have to define that this is what I am putting across actually.
yes, that should be identified from the beginning in the protocol itself, that you are going to use this. Again, if it is so new, then you should always go either for a grounded, or you can start with, you can do one more thing. You can start anything as a qualitative descriptive.
Descriptive. I was just going to say that the safest.
Yeah, and the moment you think that uh, you are getting something more, you can admit that, like while you write. Initially, you can write that in the protocol, but then again, when you are drafting your manuscript or submitting the report, you might say that because it is not that watertight compartment. It depends how the participants, the interaction between the researcher and participant, and if some new insight is coming which you have not thought of earlier, then you
Right.
definitely change it probably to grounded theory or to phenomenology, any of the interpretive design also. So that can also be done. There's nothing, there's no rule that if you have committed in the protocol that it is a qualitative descriptive, you cannot go. Because in the quantitative also we do the same thing. Initially, you see the data, you commit that you will do the statistical analysis based on this. But when you see the data and when you like see that, I can apply this test also, or
Sure, sure.
see this can also be done. So we definitely move ahead. So in protocol, you give a rough structure that's your plan. But what?
Right. Panel studies, we do that. Longitudinal panel studies, that often happens, over a period of time. As you get more information in depth, you tend to have some revisions.
Yeah.
Right.
So
Okay.
it's just
Thank you.
protocol is just a rough guideline how you are going so that it keeps you on track. You should not deviate. And one more thing, like a protocol is a guideline when you have to lead a research. Maybe you have to train people and give them instructions. So that acts like a guiding document. So that primarily you should not deviate from your RQs and the methodology. But yes, if it is needed, then definitely you are the researcher, you are the lead person, so you can definitely go. The only thing, like, we inform our IEC whenever there is some deviation in the protocol. We do write to our institutional ethical committee that because of such reason, initially we have said that we'll do, but currently in this protocol also, like we did one study with the RSV, which we said there we have initially planned to do a focus group discussion, but when we actually tried to do FGD in the field, in the PHC, it was like a group interview. It was not like a focus group discussion. So we thought, like, let's do an in-depth interview rather than going for a FGD. So then we communicated that the data collection method, we will only be doing
Right.
a in-depth interview. So that definitely any change is always allowed. The only thing, like, you should communicate and it depends from the institute to institute also. Here
To
we
the IEC, we communicate it to the IEC.
yeah,
Right.
ethical, we keep updated to the IC because we just have to mail them that see, these are the deviations from the protocol.
Right. Thank you.
My pleasure. Welcome. So you can see now the difference. These three, like the first is the background, then there is a problem, and then if you solve that problem, then what advantage it will have on the patient care or overall society. That's the significance of the protocol. So this three, like background, problem, and significance, these three makes the problem statement. So again, this is one excerpt. So any other participant who would like to read this paragraph?
Am I audible, ma'am?
Yeah. Dr. Jalinder, yes, you are audible. You can.
Despite the availability of iron and folic acid tablets for pregnant women in the district, consumption remains alarmingly low. This is particularly concerning as iron and folic acid is essential for preventing anemia and related complications during pregnancy. Health officials are worried that the low intake of iron and folic acid tablets is contributing to serious maternal and neonatal health outcomes, including postpartum hemorrhage, low birth weight, and intrauterine growth restriction. Addressing this issue is critical to improving maternal health and birth outcomes in the district.
Thank you, Dr. Jalinder. So yes, if I ask you to identify the background, so up till what you can think that it is the background of this problem statement? Yes, so you can see anyone who can try. So that's the for sure that initial few lines background.
And
Yeah.
first two sentences.
Yeah. So despite the availability, because you know that there is the availability, and in spite of that, the consumption is alarmingly low. So that's the problem statement. That's the background. And then, okay, these are the questions. So then what next? What is the problem here?
The health officials are worried about low iron intake, IFA tablets.
Yes. And then what is the significance here?
That it is leading to the maternal and neonatal health outcomes, including postpartum hemorrhage, low birth weight, intrauterine growth restriction.
So yes, addressing this issue will help tackling these complications.
Yes, ma'am.
So you can see that once you are done with your problem statement, then you make your purpose statement. So there are two components, the problem statement, which has that background, which we have just seen, the problem and the significance. Then comes the purpose statement where you write the purpose of this study. It always starts like we write objective in quantitative. here you write this in the form of a purpose statement. So a purpose statement should have something known as the central phenomena. So central phenomena is the core idea of research. Like in this case, the study which we have shared with you people, that is the communication barrier. So my central phenomena for this research would be the communication barrier. And then you should have, it should have an idea about participants also. Like in this case, it is the healthcare professionals or healthcare workers. And then like that PICOT format, which we do for quantitative, where there is a population, there is an intervention, there is an outcome, there is a comparative study, and there you write about the time also if plus minus is there. So similarly here, this participant is P of PICOT, that is also there. And then this central phenomena is the core idea of the study. So it depends, like like what we did yesterday, a lot of studies were there. So you can identify central phenomena of that study. And in this case, like I said, it is the communication barrier. And then it should have something about the site of the study also. Like in this case, we have written a tertiary care hospital. So where you are doing, either you are doing in the field, in the community setting, in a hospital or a facility setting, that you should write. And then you should have some words which is like a qualitative in nature, like perception, the purpose, the intent of the study. And then it should contain some action words like to understand, to explore, to describe, something like that. Because they are also in objective. Whenever you frame some objective, remember we always talk of these action words, like to estimate or to measure or to analyze. So those action words we use in the quantitative. Similarly, in the qualitative, the action words would be to explore, to understand, to describe, and it should have a neutral or a non-directional language. So like this is one example of purpose statement. So it is saying that the purpose of the study. So purpose word should always be there. The purpose of this study is to understand why healthcare workers face barrier in effective communication. So this healthcare worker is the population. The barrier in effective communication is my central phenomena. Again, I'm writing in a tertiary care hospital is my setting. So central phenomena is the core idea which I'm exploring in the qualitative study. And this is the suggested script for writing a qualitative purpose statement. So we have taken this from a book which is known as Starrell. I think we have shared that book. We have shared 2-3 books with you people. One is the Creswell. So most of the content is from the Creswell and from this Starrell. So you can see we should have given the reference in each slide, but that is, I mean, we could not do that. So we are sorry for that. But this is again from that book. So they have suggested that you should write that the purpose of this qualitative approach. So like you can write this phenomenological study is to then action, to understand, describe, develop, discover the central phenomena. Like in this case, the barriers in communication for healthcare worker, in bracket it is written participant at a tertiary care hospital, which is the research side. And then at this stage in the research, the communication barrier, that's why they are writing at this stage in research, because it might change when you later do the interview them, what do they understand. So at this stage of the research, the communication barrier will be generally defined as, and then you have to write the general definition, and this general definition is of the central phenomena. So the communication barrier, how do you define communication barrier? You can give a few words or few sentences regarding to that. So like I can write here that this is something different, not related to the communication barrier. Just for example, we have given this. So if I say that the purpose of this qualitative study was to generate a theoretical model that explores what the low-income rural families, which is the research site here, with the young children do for the acute health event. And acute health event is the central phenomena from the perspective of mothers. So if my statement is this, then if you have seen this, what should be the component? What is missing in this purpose statement?
How is missing?
What is missing? Like which component? this you have seen. So in this case, what is missing? Maybe here you can
How to classify low income?
low income. Yes. Good. You may add more. Basically, what we have seen here, this part.
The
You have
general definition
of.
of the central phenomena, like
So what is the central phenomena here?
Acute health events.
Yeah. So basically, outcome, which you see that outcome generally of that picot is the central phenomena. In case, like if you want to have some reference from quantitative, then basically outcome is your central phenomena. So here, like it is the acute health event. So you need to define, you can define the low, that definition, it will come more in the methods. But again, here in the purpose statement, it is basically you have to define what do you understand by acute health event. Is it last 15 days, 2 weeks, or 1 month, or something like that? Events happening in last 2 weeks for this. Like you can have quote this thing like maybe a pneumonia or maybe diarrhea or some infections, some injury. So that you have to write. Okay. So that definition of the central phenomena, it is missing here. Similarly, if this is the question, the purpose of this multi-site qualitative case study is to explore how adolescents talk about tobacco use in their schools and in their lives. So here what is missing? What is the missing statement here, or the missing part? Yes, anyone? Or you can type in the chat box. No one? Are you guys listening?
Yeah, but I'm a bit lost actually, in terms of
It is just the
your
definition.
question. Right.
Because
Okay.
here also the same thing is missing. The definition of central phenomena. How to define this tobacco use. So in all these two statements, like here also it was the definition of central phenomena, which was missing. And here also it is the definition of central phenomena, which is missing. So we have done the purpose statement. So till now, what were the two components which we discussed? We discussed first is what was the first one? Yes, all of you please write in the chat box.
Madam, problem statement, and
Yeah.
next one was the purpose statement.
Yeah. So problem statement, what are the three components of problem statement? Yes, you write in the chat box.
Background, problem, and significance.
Yeah, very nice. And what about the purpose statement?
It contains central phenomena.
Yeah.
It contains idea about the participant, that's the
Yeah.
population.
Very
Idea
good.
about the site of study.
Yeah.
Then
Type of study.
about the purpose or intent.
Yeah.
Then
And definition, and how you are
definition.
defining the
Yes.
central phenomena. How you are defining the central phenomena. Okay.
Yes, ma'am.
Thank you. And then comes the research question. So we generally get the research question from the purpose statement. And you can see like there are two types of research question. Basically, you have got a one central or a main question, and then you have got sub questions. So like sub questions are the smaller sections of that central question, and these sub questions help you in forming the interview guide. So basically what interview guide you form, that is based on these sub questions. Remember, in quantitative we write like primary objective and then we write secondary objectives. So secondary objectives like comes after primary and they are not that much significant. But here these sub questions are somehow, they will be related to the central questions. They will not be different, entirely different from the central questions. So central question, it is the broadest. Like you can see like aim. In quantitative, generally we say that aims and objective, the aims are broader. So this central question is the broad question that should be asked. from the topic which we have identified as the central phenomena. And it begins generally with the words such as how, why, or what, which we have done yesterday. And but generally the author is saying that the central question, it should not start with the word why, because then, initially if you start, this why word should be there in the sub questions. Because then why generally the author says that it raises that quantitative cause effect language. Means if you start with the why, then probably many times they are unable to answer, and that hampers the rapport of the researcher and the participant. So initially you should not start with why with the central question. Why should come in the sub questions. So this is the ideal order of a central question element, like what and how. Then you write the central phenomena, then participant, and then site. So like how does this communication barrier, or what does this communication barrier mean for the healthcare worker at tertiary care hospital? Again, this is one example how newly joined MBBS student adjust at AIIMS Patna. So if I need to improve this research question, what can I add? So I can add like what are the coping strategies that first year MBBS student they use to adjust in their first year at the AIIMS Patna. So
what is the response to that?
Response will be like, I didn't get your
No,
question.
it's pun intended actually. On a jovial side, I'm asking, since you're based in AIIMS Patna, the answer to this would be interesting. No?
Okay, that we need to explore. This is just one research question which we are sharing. And then there will be sub questions. So the central questions, they are subdivided into several sub questions. And then these sub questions, like I said, that forms the core content of your interview, or if you are doing a participant observation, those sub questions, they are related to the central questions. So like in this case, you can see if my central question is, what does it mean to be a medical college professor? Then the sub question could be maybe, what does it mean to be a medical college professor in classroom, as a researcher, as a thesis supervisor, or in a social life? So these are various domain, you can say, or the various sub part of so it is further defining. What does it mean in what all domain, in what all arena. So it is just defining these central questions more in terms of these sub questions.
Can I ask a question?
Yeah, sure.
Yeah, see, I mean, these are quite a few questions actually. So these not necessarily come out of the mind of the researcher. He or she has to probably, build them by speaking with someone. So
Yes,
does that happen? Yeah.
See, whenever you will do the literature review, if it is there related to this topic,
if it's not there,
if it is
do
not
you
there,
speak to?
Then definitely you can speak. And there is one more idea, like you can have, even for developing a rough interview guide, you can talk to few people initially, like one
Participants.
yeah,
Prospective participants.
Yeah, and don't include them. Probably if you don't want, you don't include them in the final interview when you are doing the
Right.
analysis. You may include them also. It depends. And then if you have that rough interview guide, then you can, because you see the interview guide, it gets refined also whenever you do the qualitative research. We did one research on HIV, that is on social stigma. So Kala-Azar and HIV, both patient co-infection. Their like cost and their treatment, how much delay was the treatment to their Kala-Azar, and they were not getting treatment for the HIV. They were only getting treatment for the Kala-Azar. So there, I think after 3-4 interview, we could have our main interview guide, because initially, like we were also not we were clueless, like what to ask.
Exactly.
So, but you start asking, and initially, like we will discuss more that in the art of interviewing. Initially, when I heard my interview, like I listened it and I make the transcript, only it was me who was speaking, and participant was saying only yes or no. So it was such a bad interview that I could not analyze anything. And then I realized, like as a medico, we are in a habit of, saying too much.
Imposing.
Yeah, all the time advising, saying, and we think that we know everything. and the patient should listen. And we are like a kind of judgmental. So I was always asking leading question, isn't it? Yes. So what the person will say? He will say yes or no. And then you will see that when you will go through the transcript, you have got nothing to analyze, because I am speaking too much and that person is speaking only one line. So you cannot analyze a researcher transcript. You need that respondent transcript. So that's why I'll say that it takes time to even develop that interview skill. Yes, don't think that,
Right.
I don't think that if you are a medico and if you are like XYZ in any position, you can take a good interview. Again, it's an art. And after doing and seeing your own work, you tend to realize that what all mistakes you were doing, and then you gradually improve over time. So those skills, we'll see what are the there is one slide where there is a what should be the qualities of a qualitative researcher. So
No.
should be like imbibing those qualitative, because I said that it is entirely different from a quantitative. Here you need to be very much patient, your body language should be very calm, and you should give a lot of time to the participant to think and answer. You cannot be in hurry, like to get the answer immediately. You should not be seeing the interview guide every time and then asking them again. That will lead to a loss of rapport, and you might not get very deep insights into many of the issues. So yes, we'll discuss that more in the art of interviewing. So these are all the sub questions. And then again, this is one question, which was the central question, that how person living with AIDS represent and image their disease status. So you can see the sub questions like what does receiving an AIDS diagnosis present? So it is just we have divided it into the various component, like what is difficult or easy about being diagnosed with AIDS, or how did the patient first become aware of their diagnosis? What was their perception of AIDS before being diagnosed? And maybe here also, how did they cope with that news when they heard that they are suffering from HIV or AIDS? Again, this is one example of one major central question, like what is the perception of commuters for type of transportation used to go for work? Then sub questions, you can similarly, you can have sub questions related to that main central phenomena, dissecting it more, and then asking those particular domain from the participant. So sub questions narrows the central question to the specific aspect that we discussed. And generally, we should write at least 5 to 7 sub questions in a main central questions. So the summary of
Ma'am,
yeah, Dr. Pallavi.
ma'am, I wanted to ask, is the sub questions are the sub-secondary objectives of the
No,
study?
actually, just as a comparison, I said that primary and secondary. In case of a quantitative, secondary objectives are entirely different from the primary. It is not like leading to the primary. Answer
ma'am.
to a secondary objective will not give you the answer to the primary objective. In case of a quantitative.
Quantitative study.
Here, the answer to second sub questions will give you to the answer of the main central question. So the difference is that. The only thing I said that you divide it into the central question and sub question, but it is entirely different from the primary and secondary objective in terms like the answer would be different in case of a quantitative of the objectives. But here in case of a qualitative, the sub questions, answer to the sub questions, ultimately it will lead to an overall answer of your central questions.
Okay.
Did you get it?
Yes, ma'am.
Okay,
Thank
thank you. So just to as a summarization of this overall protocol, how to draft a protocol, you have to write the background. Then you should write the problem. In the background, again, these three constitute the problem statement: the background, the problem, and the significance. Then you write the purpose statement. Then you write the research question. And then you have to write the terms and meaning. So this was regarding the first three components, which we have learned: the problem statement, the purpose statement, and the research question. The research question is again subdivided into a central questions and sub question. Then comes like in central question also, in the central phenomena also, you define the term of your central phenomena whenever you are writing that purpose statement. But here also, like one girl said about the low income. So all other terms and definition you have to define here. In the main purpose statement, you define only central phenomena, but rest of the term, because qualitative, you need, like if you are doing something in domestic violence, how do you define domestic violence? Like some sexual, if problem is there, then how do you define those problems? So for every issue, you need to define those terms which you are going to use in the study. Then you have to write the assumptions also. So assumptions means we believe that those assumptions are true, but we cannot verify it. Similarly, like in case of any, see, if I'm doing something on intimate partner violence, I have to believe what the woman is saying. I cannot verify it. So you have to go by the words, even if it is due to, because of some social desirability bias, that person might not come with the true thing. But there's no other way you can verify. So assumptions are like, it's written in your document also. Like you assume that whatever participant are saying, that is true. And even if they have some reasons for the, they know within themselves, but they are not coming up due to the social desirability bias, you can't help it. So those assumptions you should write in your protocol. Then you write the limitations also. So limitations means those factors which are outside the control of the researcher. So that you write, and then you write the delimitation also. So what is delimitation? So delimitation is what author actively put the limitation. Like maybe I'm only doing in AIIMS Patna. I'm not doing a multicentric study. So this is one of the limitation. So if you see the generalizability, maybe it might not be applicable to a primary healthcare center or a hospital which is of a primary and secondary in nature. I'm only doing it in tertiary. So factors in a primary health center might be different from a tertiary care center. So that is my delimitation. So there are two things here. Generally in the quantitative research, you write limitation only. You don't write delimitation. There, I mean, here in case, of course, it gets divided into two parts: limitation, which you cannot control, and delimitation is purposefully if you are putting some limitations like age group or maybe some other limitation. If you are putting, you have to write that. And then you summarize your proposal in a very short word. So these are the two, these were the components of introduction. So after introduction, it comes, so these are the only, till now we have only reached to the introduction. Introduction is long in case of a qualitative research, whereas if you see in the quantitative, it is very short because you only write in the quantitative. You also write in the introduction like background, rationale, how your research is innovative, what it is adding new to the already existing literature. So these components are also there in the quantitative. But here in the introduction, if you see the major headings, it starts with the problems, problem statement, then purpose statement, then you write the central phenomena, and then you write define the terms, then you write the limitations, you write the delimitations, then you summarize it. So those things should be the part of our introduction. Coming to the review of literature, the review of literature in case of a qualitative research, it often starts small because again, I said that it depends how much work has been done previously. Your review of literature will be that much. So if it is a very new topic or very less work has been done, because qualitative, I said that it is very, the problem is very context specific, very local specific. So you might not get many or much review. So it starts as a very small, and again, you need the review of a qualitative finding. Even if some, like we were doing a study on vasectomy, so the review is Parvati here, Parvati or Ekta? Ekta, are you there?
Yes, ma'am.
Okay, so can you share your experience regarding when you were doing the literature review for that vasectomy, when you were doing that qualitative research? How much?
Yes, actually, ma'am, I looked for same kind of articles on it. Means
Okay, so
previously, how many research were done on the same topic of vasectomy, male perception about the vasectomy, and yes, ma'am, from there I got the clue what are the previous existing evidence available for that topic.
Okay, so how
So
many
I mean,
studies could you find? How many studies could you find? Can you recall?
ma'am, it was 10 actually,
Okay, so
10
there
around.
okay, thank you. So there
All
were
can
were
we-
qualitative, not on quantitative study. Literature were very less.
What was the search engine that you used
I searched
or
PubMed,
databases?
PubMed and
All
Google
right.
Scholar.
Thank you very
Mostly
much.
I use this.
So generally, it depends on the facility of your library also. In our library, we don't have many of like Web of Science, and if you see those, and qualitative journals are generally not every journal don't take the qualitative research. There are
Exactly. That's why I wanted to know specifically whether there is a defined portal domain where we can search for qualitative papers,
generally the
publications.
SAGE Elsevier, they do there. Then there's
Elsevier,
the BMC Public Health or BMC group of journals. They publish qualitative. PLOS publish qualitative. We have it's the last session. We are
Oh, okay, we have it. All right. Okay, thank you.
Actually,
I
ma'am,
jumped the gun.
international journals were more available on this topic. The on the topic I was doing research.
PubMed. On
Yeah,
PubMed.
on PubMed, yeah. International
All right.
researches were available, but Indian very few
context.
researches were
Yeah.
done on that topic.
Indians don't
India
believe in
scenario.
qualitative research.
Yeah.
So, all right. Thank you very much.
Okay, so you can see like Ekta could find 10 articles, but there can be reasons like when we were doing a few researches on qualitative, like I did one on HIV and then on this lymphatic filariasis. So we could not find much of the qualitative work. In that case, you will see that your review literature is usually not that great, not that much when where you like in case of a quantitative. Quantitative, you get a lot of studies, but in qualitative, it depends on your research question. It can be many more, it can be less also. There can be a case when you will not find any of the study. But again, in that case, you can start even without a literature review, or even with like some other problem, like maybe social perception for some other disease is there, then you can use that framework and you can give some of the literature review. So it helps to understand the background of the problem. And again, like it said, if it is a standalone review, you can also write it that way. So
Can we get a qualitative research published if there is no literature review in that particular
yes,
research?
yes, they are more than happy to get it published.
All right. Okay.
Because it's
Thank you.
I said that they got some Gates Foundation grant also for publication, the study which I was citing. So
Okay, great.
so it
Thank
depends.
you.
Yes, definitely. If it is qualitative comes up with very new ideas and very new insight. So
Yes.
again, but journal selection is important. Like every journal will not understand your viewpoint. So there are journals which definitely publish.
Okay,
Then again,
great.
coming for the steps of literature review. So you have to create an outline for literature, and we'll see what is this outline, and then you have to whatever you read, you have to summarize that, and you have to, again, I said that it is the researcher who formulates everything. So you have to check for the validity of those findings, and then you have to see like, does it seem accurate to you in your population, or whether it is coming from a trustworthy source, like a good journals, maybe what they publish. And if are you convinced with the validity of that research or the finding of that research? Even if you are not convinced, then do you think that that can happen? Because see, it's the multiple reality. So that reality, are you ready to accept those realities? So in the doing this literature review, you have to see the difference between the primary and secondary source of literature. The primary and secondary source of literature means like there are many times then they cite somebody else's work. So you need to see those citations also with the primary author. If whatever their work is, you can only use their work. And then journal impact factor is also important. But again, just because something is published, it doesn't mean, especially in qualitative, that it is valid. So you need to check these things before you go for those referencing and those, review of literature. So the most important point in doing this literature review is whatever you read, just that we do in the quantitative also, but you should highlight, because the qualitative is all about statements. It's not, no figure is there. So you should like highlight with highlighter, or maybe in the PDF reader, or even if you are reading it over your laptop, you should highlight and you should use those sections in the review of literature. And again, there it is done very nicely in the any reference management software like Zotero and Mendeley, because that helps you in writing the discussion also. But you should do it, because ultimately then again you will have to go back and check most of the time, which is not very easy. So in case of qualitative also, even if the number of articles are less, you should use the reference management software for the management of those article. And then a very important thing in case of a qualitative, which is not there in the quantitative, is the mapping of the literature review. This is a new term which we have also learned when we read that book. And in that case, you need to synthesize that review. Now, what do I mean by synthesizing that review? That like Dr. Abhijit was saying, although about those sub questions, or in that when I was reading that central phenomena, when he was reading regarding the communication barrier, that low literacy or maybe the lack of communication tool. So those factors I have identified from the literature review. So if my research question is like, why young females do not accept technology as readily as young males? This was also a study done in the, probably in the Stanford or some organization. There they have read, in that book you will find this study, that they have given the reference of this study. So they have done this study, like we as a female, we are less maybe you can say tech savvy, and we don't accept technology as readily as the young males. So then they have like done the literature review, and then they have seen that what were the factors in the literature review. So they made a map of this literature review. Like then they have classified, like it can be the home environment since beginning, how they are working in the home, their socioeconomic status probably. If the women is from a low socioeconomic status, then they are less tech savvy as compared to a high socioeconomic status. Then belief in themselves, like self-efficacy. So they measure their self-efficacy also, their intrinsic motivation to use technology, the learning style of the women as compared to the men. So all those factors they found out in the literature review, and they made a literature map. So now what will they do with this literature map? They will use these components to make as a part of inquiry. So they will have those some questions, because when you are going to ask something, you should have a rough guideline in your brain also, how you are going to ask your questions. That's the rough interview guide. In case of a qualitative, you cannot have a final like questionnaire, but yes, like Dr. Abhijit is saying that it is similar to the social mapping. Yes, anything you map, especially in qualitative, there's a lot of emphasis on a pictorial representation. Even if like themes and categories, when you link these together, we will see in the grounded theory, because ultimately in the last you will have, if you analyze, you will have those codes with you, and then you have to merge those codes into categories, and then you have to finally come up with a theme. So there also you are doing a kind of mapping only, linking those codes with each other, and then linking categories with each other, and so on. So here in case of a literature mapping, it's basically identifying the factors, and here it is one way. I have only shown you like one factor leading to these like gender differences in technology, but like you have seen in case of a quantitative, there are many moderating variable, there are confounding variable. Here also you can link these factors, but that will come at the last, maybe when you make a final map of your research study, so which has come up. You also make, you must have gone in many of the qualitative research, they depict it with a map or some diagram or figure. So that is the map here in this case. You can see that these were the factors which they have identified. So the review of literature should also include, you can have a review of methods, what the previous authors, either they have used phenomenology or they have used qualitative descriptive. So if they have used qualitative, descriptive, and you want more insight, then you can go for a phenomenology also. So those review, like, then it will add novelty to your research. If they have used some other method and you are inclined to use a different method, that can add to a novelty to your research, and what tools they have used. So we have done the introduction and the review of literature. Next comes the methodology. So in the methodology, and we have given you that document. So everything is written, so you can refer that document also, and we have given you one pager, I think one pager also, which has only the headings of these protocol in the drive. And then you can, if you have to submit a protocol and in the qualitative research, then you can use that rough guiding document in the formulation of the protocol. So next comes the methodology. So methodology, again, we discussed the methodology yesterday. So it is the combination of your axiology, ontology, and your epistemology. You should always write research paradigm in your methodology. So if you see, these are the sections of methodology. You should write the qualitative paradigm, which we have discussed yesterday, the research design, whether it is a phenomenology or whether it is a grounded or narrative, whatever types we have learned yesterday. Then you should write about participants on how you are going to sample them. And then you write the instruments regarding your interview guide, whether you will go for an open interview or you will have some semi-structured interview guide. Then you have to write regarding the research procedure. Then you have to write what are the plans for data analysis, like what type of coding methods you are going to use, whether you will do a manual coding or you will use a software for the coding. And then we'll learn these things regarding the coding and all in the section of coding. Then you have to give the ethical considerations, like how you are going to, save the data, regarding all those ethical, for how many years you are going to save the data. If it is saved in the computer, then whether it will be password protected or not, who will have the access to those recordings. And then after you have made the transcript, what will you do with the recordings? Are you going to do a member checking or not? Or will you be doing a piecemeal publication, or you will do a single publication? So maybe that we don't write about the publication, but are you going to take informed consent, written consent or not? Or is the participant what good you are doing to the participant? So there is a format also, like we need to submit that in our IC. So those ethical form you will submit also, and you will try to abide by those standards, ethical standards in your research. And then comes the plan for presenting the result and summary. So yes, I think yesterday we were talking about one study, I think, which Dr. Shamshad was telling me regarding. There was one study done, a qualitative study in 1970s in Stanford University on prison. I guess that was on how the prisoner and the guard, they behave. So they have randomly assigned the students as a prisoner and then as a guard. And they have, like, it was a simulated jail, and they just they were viewing like from the outside, like just like a big boss uh, for a month or two. But then at the end, they have seen that the things were going out of the hand, and the people who were like in the role of guard, they were like turned out very violent, and they were like punishing the prisoners. So it was a Stanford prison trial. So you can see this in the internet. There are videos. There is a movie also made on this Stanford prison trial. So you can see how those experiment, if you don't go by the ethical standards, how the outcome was very bad, and they had to, like, government has to intervene to abort the trial in the middle. So because they were not going by the ethical standards, and that was a qualitative this thing which they were doing. So you should go with those ethical standards. And then again, after this methodology, I think we are done with this section of this protocol development. Okay, so should I 5 minutes? So before we start the next session, which is on art of taking interview and how to develop interview guide, sorry. And you have to develop an interview guide. So after this session, we'll have breakout room, And we have, in the breakout room, we are having 4 people, like each breakout room will have 4 people. So there will be one group leader. So you can identify the group leader among yourselves, and there will be one record keeper who will check the timings and like whether everything is going in the right direction. And then the rest of the like other 2 people will help in making this interview guide. Okay. So we have shared the Google Sheet. We are sharing the Google Sheet with you people. It will not be done now. After I take the session on the how to develop an interview guide, then I'll take how to do an interview. Is that okay? So it is 10. How much is time? 10:30. 38. So 10:40. So we are coming back 10:45. Is that okay? Okay. Thank you.